Let's talk about something a lot of people aren't warned about after gastric sleeve. If acid reflux started after your surgery, this might be why. After gastric sleeve, your stomach is much smaller and shaped more like a tight tube. That smaller space creates more pressure, and pressure pushes up stomach contents upward into the esophagus. The valve between your stomach and throat, the lower esophageal sphincter, can also become weaker or overstressed. When that happens, acid doesn't stay where it's supposed to. Another piece people don't realize is how fast food moves after surgery. Faster emptying can irritate the stomach and actually trigger reflux symptoms. And here's a big one. Some people already had a hyanuria or develop one after surgery, which makes reflux even worse. Now, here's the twist. Reflux after gastric sleeve isn't always from too much stomach acid. A lot of people actually have low stomach acid, which leads to poor digestion, gas pressure, and reflux like symptoms. That's why many sleeve patients experience things like chronic throat clearing, post-nasal drip, hoarseness, morning nausea, chest or upper back pressure, or what we call silent reflux without that classic burn. So, what can help? Eating smaller portions, even years later, slowing down and chewing your food really well, avoiding liquids right around meals, not eating within 2 to 3 hours of bedtime, staying upright after meals and reducing pressure on the abdominal, also starting to take melatonin at night, 3 to 5 milligrams, to help strengthen the esophageal sphincter. And while acid blockers can help short term, long term use often doesn't fix the root cause, especially after gastric sleeve. If reflux started after your surgery, this deserves a deeper functional look, not just more medication because it's just a band aid. If this sounds like you, comment reflux and I'll break down what a root cause approach can look like.